DHB deficits growing, capital spending deferred and delayed, a mental health system under immense pressure, tension between the ministry and some district health boards, leaky buildings, and a question: if, as Labor claims, health has been massively underfunded, what will next week's budget do to address that? Tonight, as part of a special RNZ pre-budget series, political editor Jane Patterson looks at how the previous government funded the health sector and what we can expect from this government next Thursday. Here is Jane Patterson.
Kia ora koutou. Kia ora koutou katoa. Kia ora ana.
Jacinda Ardern launched Labour's election campaign promising billions more for sectors she said had been neglected under National. So with the coalition government committed to spending an extra $8 billion over the next 4 years on health, is it true National underfunded the sector? Health Minister David Clark reckons more than $2 billion is needed just to get health funding to catch up to where it should be.
If you put in all of that historic underfunding on top of what's needed for the current year, that would be an enormous sum of money, and we won't be doing that. Taxpayers expect us to be responsible in terms of the way in which we deliver services to make sure we get the most value out of every dollar that we spend, and we're determined to do that. So we will meet cost pressures next year, and there'll be a little bit of that historic underfunding returned as well.
For capital spending alone, David Clark says Treasury has estimated it will cost $14 billion over 10 years to get health assets. That's things like hospital buildings up to the standard they should be.
The prior government put a few $100 million aside, and I think you don't have to be a mathematical whiz to realise that a few $100 million isn't going to address a $14 billion pipeline. So no, they didn't adequately fund for it.
Before he left Parliament, I sat down with the former Minister Jonathan Coleman to talk about his stewardship of the health portfolio. He says money to keep DHBs operating was clearly a major demand.
The fact is, though, that you have to make some savings, you have to reprioritise services, so that's always a big one. But there's also other initiatives. I mean, the $2 billion that went into the care and support workers settlement last year, that was money really well spent, benefited 55,000 of the hardest working people in New Zealand, of course, mainly women.
In last year's budget, National allocated almost $4 billion in extra funding over 4 years, saying it was the biggest increase in 11 years. DHBs received an extra $439 million a year over the 4 years. However, just a few months ago, health officials warned DHB deficits could hit a combined $225 million if nurses accept the pay deal currently on the table. Even without that deal, the combined DHB deficits for this financial year were forecast to be $189 million. I asked Dr Coleman if the financial screws were too tight under National.
The deficits as a proportion of the total budget were no higher under National than they were under the previous Labor government. So this huge focus on deficits is in some ways construing the debate. I mean, those deficits are a fraction of the total budget. Labor said they'll put $8 billion into health. If they've said they would do that, and that's what they promised on the campaign trail, they've now got to stump up and do that and make good.
The National Party leader Simon Bridges says there's nothing wrong with financial discipline.
More money doesn't equal better always. I think it is important, call me old-fashioned, to have some tension in the system where you are holding DHBs accountable, you are pressing them to perform.
The most recent Auditor General report on DHBs notes one of the many costs contributing to financial pressure is what's called a capital charge, a 6% levy on the cost of any new buildings. And it says it's not clear what the charge is actually achieving, and if anything appears to be giving DHBs an incentive to use debt funding. Peter Glensaw, a former DHB chair and former head of DHB NZ, says it's a major problem.
It begins to impact negatively on your operating income because you're having to pay interest for any money that you borrow, plus this capital charge. So the minute you build something new, there's a whole series of new charges that come in on your operating budget and add pressure on an already pressured situation.
As an opposition MP, David Clark was critical of the capital charge. What's his view now as Minister?
I think it needs a really good look. Yeah, I do.
Treasury admit that it may have caused delays in investment that has led to infrastructure getting to its being past its use-by date. It seems very sensible to me that we look at other ways of doing things.
Agencies including Treasury and the Office of the Auditor General believe DHBs haven't been spending as much money as they should have on maintenance and upgrades due to their challenging financial circumstances. In the year to February, DHB capital spending was $225 million, $140 million below what was budgeted for them to spend. Last month, Treasury said that suggested some DHBs could be deferring repairs and maintenance to meet operational demands. It warned there was a risk of an emerging health infrastructure deficit, which would need extra government funding. The most recent Auditor General report on DHB said financial sustainability was an ongoing concern, and DHBs were under pressure to deliver more during a period of constrained funding increases. Dr Coleman said National spent $3 billion on new hospitals and buildings over its 9-year term, and there was also capital funding for individual DHBs.
To try and say that there's been a diversion of capital funding into keeping operations going, so the running of the hospital, that's actually quite incorrect. They're two separate streams.
Peter Glensaw says there's no question funding should be increased.
At the moment, it's pretty dire that DHBs for many years have been working to be as efficient as possible and to do the most with the money that they have available. And I think that there is none or very little fat in the system.
The government has already said it won't fully implement a $10 reduction for GP visits by July, as promised on the campaign trail, due to funding shortfalls inherited from National. Simon Bridges says National didn't leave any deficit surprises.
I certainly don't take this, whatever you want to call it, crisis, the sense of, serious underfunding seriously. I think it is politicking to lower the expectations around the budget. And I think, actually, you've got to say a point that's perhaps been missed somewhat in the commentary. We've got fiscal responsibility legislation in New Zealand. They saw it all there.
The Finance Minister, Grant Robertson, rejects any suggestion the government has overpromised.
Having come into office, the extent of the issues that we're facing becomes clear. And it's all very well to have a pre-election fiscal update that gives you the numbers on a spreadsheet, but the reality of getting into government and seeing the conditions of our hospitals, the conditions of our schools, when you actually see the impact of that on the ground, that means that you have to look again at your priorities and your sequencing. But the plan that we've got stands.
Whatever the politics, it's clear DHBs have struggled to operate under past funding levels. While nominal health funding has been increasing, Statistics New Zealand figures show the amount spent on health as a proportion of GDP has declined since 2009. The Auditor General concludes the rate of increased funding has levelled off since 2010. It says, for example, from 2010 to 2015 there was a 9.5% increase, compared to a 37.5% increase between 2005 and 2010. The government's already committed to the extra $8 billion this term and will do more work before fully tackling the $14 billion capital bill. There are big expectations for next Thursday's budget, but ministers are already laying the groundwork for phased or delayed spending to be able to meet all of the demands and deliver on promises made. From Parliament for Checkpoint, Jane Patterson.